Hi everybody, welcome back. Today we have a very cool subject. We're going to be talking about hypothyroidism, which is a thyroid disorder that affects 20 million Americans and many more people worldwide. Okay, so the topic for today was actually a recommendation from someone in the audience. Thank you very much for the recommendation. And before we get started in the topic, I do want to let you guys know that the purpose of these videos is purely educational. I'm only sharing my knowledge. I am in no way, shape, or form giving anybody medical advice. So if you have a medical concern or a problem, please seek medical attention. Talk to your doctor right away. All right? Okay, guys. So I am going to be going over everything that you may need to know about hypothyroidism. Take notes, okay? It's going to be very informative, and at the end I am going to write kind of the bullet points on the board behind me so you guys can make sure that you got all the notes and everything correct, okay? All right, let's get started. So thyroid, there is two different types of thyroid disorders, hyperthyroid and hypothyroid, okay? Again, we're focusing on only one type of thyroid problem, which is in the category of hypothyroid, so low thyroid disorder, because it's the most common one out there, okay? Now, there are different causes for low thyroid disorders, and again, I'm only focusing on the most common type, and I'm only focusing on the basic information for these conditions, okay? All right. So basic understanding right away, the thyroid is a gland. The gland is in the neck. It sits way behind in the neck. So many times when you've gone to your medical professional for an appointment, sometimes they feel your neck. This is us trying to find and make sure that you don't have anything abnormal in the neck or the thyroid gland, okay? Now what we can actually feel is very minimal because the gland is very deep inside, but it is located in the neck, okay? So the gland actually has a very important function in the body. It not only regulates the energy, but it makes sure that every single cell in your body is functioning appropriately and it's healthy and it's well. Okay, so extremely important gland. The function is in every single aspect of your body. Okay, so we need to make sure that we understand how we get diagnosed with a medical condition like hypothyroidism, what the lab means, and I want to make sure that if you guys ever get your thyroid tested, that you are able to know what the results mean by just looking at your labs. Cool? Okay. So the most common test used to check for thyroid disorders is TSH. Okay, and again, I'm gonna write it down at the end of the video. TSH, the guidelines, the parameter for normals, it's between 0.5 and 4.5. So as long as your blood results are between 0.5 and 4.5, you're okay. Now, I say that with a grain of salt because different labs, depending on your medical facility, may change those guidelines slightly to about 4.7 or 4.9. So check with the medical facilities lab that you use, okay? But as a general rule, between 0.5 and about 4.5, it's normal, okay? Now, to diagnose a thyroid problem such as hypothyroidism, you normally see, not normally, you always see the opposite in the labs, okay? So when it's high, that means that you have low thyroid, okay? If your blood work is high, that means that your thyroid is low, okay? It works inverse, in an inverse way, okay? So it is very confusing. Normally, we are kind of designed to believe that if the lab is low, then you are low on whatever it is. But with the thyroid, it works different, okay? So if your thyroid lab is elevated, that means that your thyroid is low, hypo, okay? Now, that does not mean that you're diagnosed right away with a thyroid disorder. That means that you need to have a conversation with your medical professional in regards to whether or not you need more testing or what the next step looks like for you, okay? All right. Now, how do you know that you have a thyroid problem, or you may know? What are the physical manifestations? As I mentioned before, the thyroid is a very important gland and it literally controls almost every aspect of your body. So when you are talking about signs of thyroid disorders, you would expect symptoms everywhere in your body as well, okay? So that includes dry skin. Your skin feels really dry, okay? You get constipated, you gain weight, your reflexes become very kind of dull, maybe. You get very cold. So normally if you're not cold, you become very cold. And then you become a little bit depressed, or your thought process maybe becomes a little bit slower. Maybe you're not thinking as quick, okay? So those are all symptoms of hypothyroidism. I normally tell my patients, when the thyroid it's abnormal, so when you have hypothyroidism and it's not controlled, you normally feels like everything's slowing down. So your bowels slow down and you get constipation, and your mental status slows down and you get depression, and your skin gets dry and everything just kind of drags, okay? So it kind of feels like that. Now, once you get diagnosed with a thyroid disorder, then you get to talk to your provider about what the next treatment is for you, or what the treatment looks like for you, because it may change per person. It does change per person, actually, okay? Now, the last thing that I want to cover, there are different reasons for patients developing a thyroid disorder. I'm only covering the basic and the main one, which is the most common one, which is an autoimmune condition. The name is Hashimotos, and I will write it down at the end of the video. But Hashimotos is an autoimmune condition. What this means is that your body, it's attacking the thyroid gland. And it does it because it thinks that it's a bad thing, that your body thinks that it's protecting you and it's attacking the gland, okay? So that's how, most of the time, that's how we develop Hashimoto's thyroiditis, or hypothyroidism, which is what we're talking about today. Now, what that also means is that females are more likely to develop a thyroid disorder like hypothyroidism, usually middle age and older, okay? And if you have another autoimmune condition, or if your family has, if you have a family history of an autoimmune condition, then that also makes you a little bit more prone to developing something like hypothyroidism, all right? I hope you guys found this beneficial. Again, I'm trying to keep it very simple, but educational enough, so when you guys go to your provider for help in the medical field, you guys now can interpret your own lab result for the thyroid. You know what that means, and you know what the next step would look like for you. All right? I hope, again, that you found value in this video. Please feel free to share if you think that somebody else can benefit from it. If you have any other ideas for another video, please let me know. I'll be more than happy to work on that for you. And stay safe. I'm trying to be positive. I'm trying to spread some knowledge and awareness. Let's keep it up. Be happy. Bye.